Making of knowledge on Jeju filariasis.
In the late 1960s, Jeju Island, located in the southern end of the Korea, went through a time of change. Villages were beginning to receive water and electricity, and flights between Seoul and Jeju were being established. Yet, water and electricity was still rare outside of populated areas. The terrain of Jeju, which is mostly volcanic bedrock, made it difficult to develop groundwater, and residents were mostly relying either on rainwater or groundwater that seeps from the mountains and resurface on the beach. Wimiri, the sample village for the research to be conducted, was located in the southern basin of the island. It was about 15 kilometers from Seogwipo, which was a major town in the area. The first well was developed in Wimiri in 1965, and the early 1970s, when the joint Korean-Japanese filariasis research project was underway, became the first period that the village was equipped with public water supply and electricity. However, until then, there had been no individual water supply and sewage system or electricity, and only electric lights were installed near the main streets. It was not only the ecological features of the distribution of malaria and filaria, but also previous experience and human networks that influenced the selection of Jeju Island. It was recognized that Jeju Island was a major filarial endemic area. In the 1940s, researchers from Keijo Imperial University conducted a study on Jeju Island, and Wimi was one of the areas they researched. Wimi had a population of 447 people, about half of all those tested, and the infection rate was found to be 33.8%. More than twice as high as in other areas of the country. In the mid-1960s, a study of 30,000 soldiers entering an army boot camp found that while the overall infection rate was low at 0.63%, it was as high as 3.5% among those from Jeju. In April 1970, Korean and Japanese parasitologists began collaborating on Jeju Island. The main concern of Korean researchers was to conduct epidemiological surveys and establish treatment guidelines on the island. While the main research task of the Japanese researchers was to compare and identify the biological and clinical characteristics of malarian filariasis and Bancrofti filariasis. The material basis for the joint research projects was provided by both Korean and Japanese research teams. The research facility was completed in 1970 with donations from Seoul National University alumni. The initial research was funded by the US-Japan Joint Research Project through Katamine. Jeju had a similar environment to Hachijokojima, the only malarian filariasis endemic region in Japan, and the transmission was made through vector mosquitoes on volcanic islands and beaches. The filariasis in Hachijokojima and Jeju also had similar epidemiological characteristics. This similarity was seen as a good opportunity for the researchers to put their experience in Japan to the test in a new environment. One of the first things the team set out to do was to determine one of their main concerns, which was to determine periodicity. That is, what time of the day parasite is active in the bloodstream of the patient. To determine the periodicity of the Jeju malarian filariasis, the researchers identified infected people in the area upon arrival at the project site and hospitalized those who were confirmed to be infected, taking blood samples and testing every 2 hours.
Community and research.
The success of this research project was due in large part to the help of the local community. The cooperation of the local people was not just about the obtaining materials for the experiments. It was essential for the team to find the right person to ensure the research went smoothly. Ms. Hyun, who helped the team conduct fieldwork in Wimiri, was in her 20s at the time. Her brother was the head of the fishing union and well respected in the community. Her father previously served as the village head. This family background gave Hyun the resources to convince the community of the need for the project, and in some cases, to mobilize the appropriate authority. Moreover, because herself had suffered from filaria worms, Hyun was willing to help the researchers without being paid. Her role as a kind of local guide, research assistant, and communicator was essential. One of the peculiarities of studying filaria worms was that most of the outside work had to be done at night. Since the best time to detect microfilariae in peripheral blood was after getting dark from 8 p.m. to around 2 a.m. It was not easy to gather people in one place, as is the case with typical intestinal helminth screening methods. Fieldwork also had to be carried out mainly at night in order to collect the vector mosquitoes, which feed at night and rest on the walls inside the houses until dawn. But going door to door in an unfamiliar area, especially at night, to collect blood samples was impossible without the guidance and cooperation of the local residents. This trust to outsiders was only a part of the problem. Slipping and falling on a bumpy dirt road in the village at night was common, and high walls and narrow alleys made it impossible to know exactly which homes you were visiting as an outsider who's not familiar with the area. So, it was essential to have someone with you who knows the way. Also had a good enough rapport with the residents, that they wouldn't complain if you woke them up at middle of the night to collect blood sample. Blood collection was usually done by making a cut in the ear and collecting the blood into a small glass tube. So if a stranger came in the middle of the night and suddenly asked to cut their ear, people could not accept the idea kindly. In addition to time and place, the Jeju dialect made communication difficult, especially during the middle-aged period and earlier than that. Jeju is well known for having one of the most distinctive dialects among Korean language. Furthermore, those with high rates of filarial infection, high concentrations of microfilariae, and chronic symptoms were predominantly elderly. People from the mainland were unable to communicate even simple greetings with the Jeju people, so the Hyun also acted as an interpreter. And also to persuade people who were wary of outsiders and refused to give blood. The Wimiri people perceived body aches and fever to be primarily associated with fresh water around the sea or hereditary in nature. Therefore, they felt the treatment was unnecessary. However, the high fever and pain associated with Malayan filariasis drove people to join the project. As filariasis-related symptoms were predominantly seen in people living near the coast, where the vector mosquitoes breeds. In the first year of the research, people were reluctant to take the drugs because of its side effects. But when they saw their pain disappeared, they started to actively participate in the second year despite the side effects. However, the side effects of the drugs were more severe than what has reported. It wasn't just high fever, but hallucinations and seizures followed. In the first year of the program, one of the patients, who had been given DEC, without checking whether she was pregnant, suffered a miscarriage. And this led to hostility from the locals towards the research team. The severity of side effects was more serious than expected. So the team needed to change the way they were administered and managed. The researchers managed side effects by monitoring the subjects periodically after treatment. Because side effects often occurred at night after having afternoon dose, parasitologists had to keep managing activities around the clock after the dosing, going door to door, taking temperatures, and administering painkillers.
Circulation of medical research and knowledge.
Jeju Island was not only foreign for the Japanese parasitologists, but also for the Korean parasitologists. As they encountered an unfamiliar parasite in the form of malaria and filarial worms, the process of bridging language and cultural barriers in an unfamiliar environment with the cooperation and knowledge of the local people also provided the parasitologists with a taste of what they would encounter in their future work abroad. The presence of malaria and filarial worm on the Jeju Island brought Japanese and Korean parasitologists together in a single network, which in turn connected them with the locals. On the other hand, the geopolitical context of expanding technical cooperation and aid at the time made joint Japanese-South Korean research on filariasis on Jeju Island possible. As the Vietnam War escalated and renewed interest in Asian tropical diseases in the United States, new material and intellectual resources could be mobilized. Transnational research in the United States and Japan and Korea, respectively, intersected on Jeju Island and co-produced local knowledge on filariasis control with help of the local community. This locally produced knowledge through the joint Korean-Japanese research projects on filariasis on Jeju Island was in turn circulated in the international research community through US-Japan biomedical collaborations. In this way, through the 1970s, Korean medical professionals gained international experience, which would later play an important role in the global circulation of Korean medicine. Later, we will revisit how Korean medicine works around the globe. Thank you.